And welcome to the Building Community Resilience Policy and Advocacy Guide webinar. We're so excited to be hosting this today, and thank you all for joining us. I think we've gotten about 500 folks who RSVP'd, so we're really excited to share these materials with you and share some of the great wisdom and knowledge from our presenters today. So to kick us off, I'm going to introduce Wendy Ellis, who is the BCR Project Director. She's also a Milken Scholar here at the George Washington University School of Public Health and is a Doris Duke Fellow for Promotion of Child Wellbeing. And BCR is Wendy's brainchild, and she is our guide in all things BCR. So she's going to do a quick BCR introduction. And Daniel, if you could advance the slide.
Well, good afternoon, everyone. And as Jeff said, we are extremely excited to be here and looking forward to sharing all of our work with you and the work really from those in the field with regard to the Building Community Resilience Initiative and Collaborative and Network. And so you are going to hear us refer to it as BCR, and that is Building Community Resilience. So if we can go ahead and advance to the tree slide, Daniel, thank you. What I want to share with you first off is what we do in BCR is really try to help everyone understand what is the problem that we're trying to solve. And so we created this graphic to really talk about not just adverse childhood experiences, but adverse childhood experiences in the context of adverse community environments, hence the pair of ACEs. And so when we think about adversity that's happening at the individual level, we do understand that these things are not happening in isolation. They're happening in the context of a lot of other issues that are happening in our communities. So whether that's discrimination or community violence or thinking about unemployment or lack of education or access to education, we really have to think about all of these, what we know in public health from the perspective of social determinants. And so we use this tree across multiple sectors to really begin to not only illustrate the issue, but also help others begin to understand what is their potential role in addressing the issue. And so as we use this analogy with the tree, we remind people also that these adverse childhood experiences are somewhat easy to detect in individuals, whether we're in a social, clinical, or in a classroom environment, or even just interacting with people in various places, whether that's a coffee shop or over dinner. So it's easy to be able to detect if a mother is suffering from maternal depression during a pediatric scan, or if a child is suffering behavioral issues when we're in a classroom. So instead of just asking people what's happened, what's wrong with you, it's what we try to encourage and what we push in as far as trauma-informed practice is really thinking about what has happened. And so when we think about what's happened to people, that's when we can get into the roots of the issues. And so that's the adverse community experience part of this. And so when we think about that, we're looking at, the health of any tree can easily be gauged by looking at the strength of the branches, the vibrancy of those leaves on the tree. What is not so easy to detect and certainly not so easy to figure out how to solve are the nutrients that feed that tree. So thinking about the soil in which that tree is planted, the soil in which our communities are planted. And that is the work of BCR. We have three main areas that our teams, if you could advance the slide, Daniel, three main areas of focus that our teams across the country are working on, and that's in program, practice, and policy. Hence, that's why we're here today, is to talk about the policy aspect of our work. And so our teams have quickly formed over the last 3 years to work in not only a metropolitan area, but very much in a regional area. So our team in Oregon is now doing state-level work. We have a team from Missouri that is doing state-level work across Missouri and St. Louis and Kansas City, and you'll hear from them later. Our Cincinnati-based team is also working in the tri-state area that is focused in southwestern Ohio and northern Kentucky. And our team here in Washington, D.C. is doing work locally that affects the district, which many of you know operates as both a city as well as a state. And then also in Dallas, Texas, where we have a state team that is a mix of private and public, meaning that it's led by city leaders as well as community leaders, but is also looking at a statewide expansion. If you can advance the slide, please, Daniel. So again, as I mentioned, our work is evolving in real time as our teams learn and grow. And often here in BCR, we like to share our best practices with you. And so today what we're doing is sharing with you our latest tool that helps our teams connect across sectors and translate the work they're doing in program and practice into policy. So with that, I'll turn this over to Jeff.
Great, and we can go ahead and advance the slide. So before I get started in doing the walkthrough of the guide, just wanted to do an overview of the rest of the session. So I'll spend some time kind of walking you all through the policy and advocacy guide and some of the tools contained in there. And then we'll have a couple presenters talk about tips for effective advocacy at both the federal and the local level. And then finally, we'll take a look at some lessons learned from the field, and we'll have our Missouri partners talk about empowering community voice and how they use that to advance their advocacy agenda, as well as a presenter to talk about how to effectively utilize data to tell your story in a policy arena. So we're really pleased to be sharing this guide with you today. I'm Jeff Hild. I'm the policy director here at the Redstone Center, which is the academic home of BCR at the George Washington University School of Public Health. We'd also like to thank the Campaign for Trauma-Informed Policy and Practice, or CTIP, as well as the Center for Health and Healthcare in Schools, which helped to pull together and develop some of the tools in this guide, as well as our partners at NACCHO, the National Association of City and County Health Officials, for their help in developing some of these tools. And finally, I should thank both the Doris Duke Charitable Foundation and the Kresge Foundations, who have generously supported the BCR work. So we can go ahead to the next slide. So as Wendy said, we put this guide together because we think that the type of systemic and lasting change we need to build truly resilient communities and families is really only available through policy changes. As Wendy likes to say, our systems are perfectly designed for the outcomes we get, and I think that's paraphrasing Edward Deming. And so if we want different outcomes, we really need different systems, and that's a policy conversation. So our intent with this guide is really not to take you towards a specific policy goal or specific advocacy strategy, but rather we hope that the guide will provide you with the tools, tips, and context you need to harness your own expertise and your own experiences working in your communities to effectively advance policies that will support that work. And so while you'll see that some of the resources and tools are specifically geared towards working on issues related to ACEs, trauma and resilience, the guide is really intended to be helpful for anyone who's wanting to be more engaged in policy and advocacy. And we can go to the next slide. And so this guide is just one of many BCR tools that are available to everyone for free. You can see where to download them there on our website. And I would definitely recommend that you check out the Coalition Building and Communications Guide as kind of the partner to the Policy and Advocacy Guide. There's really great tools and tips in there around creating impactful messages and developing shared understanding across diverse sectors. And we can go to the next slide. So we kind of start out with the question of what is advocacy in the guide. And to some folks, especially those working directly in community, it can be intimidating to think about policy or to think that policy and advocacy is something that other people do, like those folks in DC or in state capitals. And so we really want to demystify the process and be clear that everyone can be an advocate for policy change. So the first thing to remember is that policy is really broad. So it can run a spectrum from a new law that Congress or City Council might enact to how a health system reimburses for certain services, to how your own organization might train its staff in issues around trauma. And so that also means that there's multiple avenues for advocating for policy change and multiple ways to do so, including by pushing for legislative or regulatory change through litigation, conducting and disseminating research, convening community members and stakeholders, or educating policymakers. It also means that there's a lot of policymakers, right? So there's a lot of folks that you should consider influencing. So these are not just elected officials, but really anyone who's in a position to create change or stop a rule, law, process or practice. And so we also like to remember and point out that policy change takes time. Most of our systems are designed to be slow-moving, and it's really critical that you stay optimistic and realize that your efforts are part of something larger. And I like to use the analogy of healthcare in this country. So we think about the first universal healthcare legislation was introduced during the Truman administration. It wasn't until the 60s that Medicare and Medicaid passed, in the 90s when CHIP passed, and then finally in 2009 or 10 when the ACA passed. So these things take time, and it's important to remember that you're part of a continuum. Let's go to the next slide. So we start out with kind of giving you a baseline of what the rules are. So when a lot of people hear the word advocacy, they automatically think about lobbying and then quickly say, well, that's not something that I or my organization can do. But it's important to remember that lobbying is just one type of advocacy, and most organizations, even nonprofits, can actually lobby under certain circumstances. And there's a myriad of other ways to influence policy debates and advocate that don't include lobbying. So what are some of the rules you should keep in mind? So first, lobbying is generally defined as a communication with an elected or government official around a specific matter. So think about talking with a state senator and asking them to vote yes on a specific bill. That would be considered lobbying. And if that's the case, there are really two kinds of rules that come into play. One are disclosure rules, which really impact people who are lobbyists, so we won't spend a lot of time on them. And the other are tax rules that are probably more relevant for today's conversation, because they speak to how tax-exempt organizations can or cannot lobby. But even nonprofits can lobby as long as it's not a, quote, substantial part of their activity. Other types of nonprofits, such as C4s or C5s, can lobby more broadly and even engage in electoral processes and politics. But the real bottom line is that you and your organization probably can lobby. You can advocate, and how much you can do so is really dependent upon the type of organization you are. It's also important to remember that your organization might have its own rules, and so even if you aren't lobbying, you can still advocate. The other thing to keep in mind is that education around an issue is almost always okay. So if you don't want to lobby, talk about a specific issue rather than a specific piece of legislation. In addition, responding to a specific request or public call for input. So these include things like testifying at a hearing, commenting on a regulation, et cetera, are almost always going to be okay. And we've got a number of examples in the guide and additional context that can help you kind of work through these questions. So we can, I think, skip 2 slides ahead, actually, Daniel. So the next part of the guide talks about developing a policy and advocacy strategy. So the guide provides a number of tools and tips to assist you in developing an overall strategy to guide your advocacy efforts. As you can see on the slide, we try to lay out some guiding principles, but the most important piece of advice really is to spend the time you need as an organization or as a network to build a strategy that fits with the overall mission of the work that you're doing and try to stay true to that strategy. Let's go to the next slide. So one of the worksheets in the guide, and you can see here, the left side is a uncompleted one, and the right side is an example of how to use that worksheet. And this worksheet can be used to examine potential priority areas and to help you kind of prioritize those accordingly. As you can see on the completed sheet on the right, this allows you to work through a number of areas to make sure that the potential priority is an area of importance. And also to determine whether you have the means and ability to be successful and how it might align with your overall organizational goals. So a good rule of thumb that we like to use is the SMART rule. So make sure that your priority is specific, measurable, achievable, relevant, and time-bound. So let's move to the next slide. So one of the other tools in this section is really helping you to move from goals into action. It's designed to assist you in developing those action items for each of your goals. So this is really going to be the meat of any advocacy work, the actual things that you need to be doing to advance your goal. So this worksheet or tool allows you to organize around goals, ensure that you have adequate resources to move forward, identify supports, and create a timeline for action. So in the hypothetical version on the right, you can see a completed worksheet. This tool can and should be used with others later in the guide related to identifying targets and finding allies. So that'll take us to the next slide. So this section is really how you can identify and reach out to those that can help you in your cause. So this can include both bringing allies into your process and joining with others who may already be involved in advocating around an area of interest. So one point to emphasize here is that many of you are part of networks, and the power and potential power of those networks in terms of advocacy is very real. So think about how you can smartly harness and leverage those networks and avoid duplicative efforts. And you can see this slide, our Missouri team there visiting with Senator Blunt last month, and Vontriece McDowell, the middle person in that photo, will be speaking with you later on. Let's go to the next slide. So also in this section, we have a couple of tools that I think you'll find really useful. So the first one is the Partner Build Grow tool that was developed by our colleagues at the Center for Health and Healthcare in Schools. This tool is really powerful because it allows you to walk through many different sectors of potential allies and think about what type of partner they might be, what your connection points with them might be, when it would be appropriate to reach out, and what your outreach message should be. You can also use this tool to track engagement with potential partners. And the tool is difficult to see on the slide, but it's a downloadable spreadsheet that you can fill out once you have the guide open online. Let's go to the next slide. So the next tool we have is the Circle of Influences tool, and this was developed by our friends at NACCHO with the help of Technology of Participation Group. This tool can really help you visualize the different levels of allies you may want to engage. So you might think that some partners will be part of your core team. You can see those in the center, and those are the allies that you'll be kind of engaged with on a day-to-day basis and sort of your key decision makers and partners, while others should be aware of your work and occasionally engaged with. So, for example, those in kind of the circle of information area need to stay abreast of your work and understand what you're doing, but you're not going to be talking to them on a daily basis. So a really nice tool to help you visualize and track some of your relationships. So let's go to the next slide. So the next section deals with how to determine who the policymakers are that you need to target. So a good bit of this section is really focused on understanding legislatures, including how offices are structured and staffed, different types of legislation, the way committees work, and how you can utilize those committee processes, and examples of different ways you might influence policy. It also includes tips on where to start and how to focus on policymakers that are most likely to help your cause. So one of the worksheets in this section is designed to assist you in mapping out targets so you can use your resources wisely. This is one of the tools we used in preparing our BCR teams for Hild Day last month, and it really allowed us to systematically target offices and prioritize meetings. So we actually use this even within delegations to prioritize like who should be the first priority for us to meet with and down the line. So let's go to the next slide. So this section of the guide really deals with, you've reached the point where you figure out what you've tried, what you're wanting to accomplish. You found some partners to help, and you've identified those policymakers that can help you move the needle. And this section is really meant to assist you in developing and delivering engaging and effective policy pitches. So in other words, you've got a meeting with that key official. What are you going to say to them, and how are you going to say it? So what we lay out in this section is really a blueprint on how to build an effective message, and we explain the elements that such messages should include, which you can see here on the slide. We also include examples for each of these elements so you can better understand what you might want to include. And one of our mantras here is that we don't have any stories without data and no data without stories. And so you'll see us coming back to this theme later in the presentation. And really, to develop an effective pitch, you need both of those elements. Let's go to the next slide. So really the ask is at the heart of your policy pitch, and the guide spends a lot of time with providing some tools and tips here. And this is really the action that you want the policymaker to take. We include some general pointers that you can see on the slide, but this should always be framed in terms of an action. But also keep in mind that it can be simple. So something as easy as asking the person you're meeting with to come visit your program. And you also want this to provide you with an opportunity to follow up with that office or individual and continue building that relationship. Let's go to the next slide. We also include some meeting tips. So as you prepare to meet with policymakers, the guide also provides some practical pointers on how to have a successful meeting and on some common errors to avoid. So after you've spent a lot of time developing a strategy, pulling together your coalition, it can be really shocking to realize that you might only have 5 or 10 or 15 minutes with a policymaker. So we hope that some of these pointers and tools can really help you zone in on what you want to be saying and be prepared for that meeting. So that was really a brief overview of the policy guide. I hope you all have a chance to download it and spend some time with it, and we hope it'll be useful in your efforts to make lasting change. So what we wanted to do next was really bring a perspective of someone working every day within a policymaking body, and with the goal of providing you all with insight into that process and to share their knowledge on how to be an effective advocate. So we're really fortunate, and Daniel, we can go ahead and advance the slide. So we're really fortunate to have Megan DesCamps here with us today. So Megan is the health policy advisor for Senator Heidi Heitkamp, who most of you hopefully know is really the foremost champion of implementing trauma-informed policies, and is the lead author along with Senator Durbin of the Trauma-Informed Care for Children and Families Act. Megan is a Capitol Hill veteran of about a decade, I believe, and has been with Senator Heitkamp for the last 5 years, and has just been a great partner in this work. And so we're really glad to have Megan with us today. And Megan, go ahead.
Great. Well, thanks, Jeff. I was asked to give my perspective as a staffer on good and effective advocacy, and I think Jeff covered quite a few of the points and tips that I was going to share, but I don't think that it lessens it to repeat them again, just to make sure that you understand, from my perspective and our perspective sitting on this side of the table, how the work you do can best be communicated. But I first want to share good news that Senator Heitkamp and Senator Johnson's resolution recognizing May as National Trauma Awareness Month, and yesterday, May 22nd, is Trauma-Informed Awareness Day, passed the Senate last night by unanimous consent. So thank you to all the advocacy work from folks on this call and beyond to really help make that happen. We also are really excited that quite a few of the provisions of the legislation that Jeff had mentioned with Senator Durbin, the Trauma-Informed Care for Children and Families Act, has made it into the HELP's Opioid Crisis Response Act package. So we'll continue to need support and advocacy to get that across the finish line in whatever sort of opioid package passes through Congress. But with that, I would just start off in saying, when you're meeting with staff, just be sure to understand and gauge where you're meeting the staff are at. Is this their first meeting and understanding of trauma? Do they think you're coming in to talk about emergency room trauma and you're going to have to explain from the very beginning what ACEs are? Or do they already work in child welfare system issues? Are they on committee? They already get it. So just be cognizant of, again, the time that you have with them and making the most of it. The other thing is, we all know our own boss's resume and legislative priorities, but it's really important for you to know that and do your research as well. So to understand as much as you can about what drives that member and what hook you can find for them to care about trauma and to care about resilience. For instance, my boss, Senator Heitkamp, is a former AG, so she has a very close connection with law enforcement. She has several siblings who work in social work, but she really came through childhood trauma through the lens of Native American children and trying to improve outcomes for Native children. Senator Durbin came through this through a lens of addressing gun violence in urban Chicago. A couple other members on the Republican side have their own lenses they come through. Senator Young, for instance, has a sister who works in social work, so he's been very active in that space. Senator Isaacson had shared at the opioid hearing in the Health Committee, he lost a grandson to the opioid addiction. So just understanding these pieces of not only personal experiences, but the resumes of the member that you're meeting with is important. And then understanding either the district or the state, their population, demographics, are there specific vulnerable populations? Do they have the older population, younger population, minority populations? Just kind of being able to understand and speak and meet that office where they are. What are some of the industries where most people employed? Is there recent media coverage or news that may be a hook on related to trauma, or coverage of any programming in the state that's particularly important? And then any sort of local people of influence who already get it, who are already in the trauma army, governors, mayors, other elected officials. I think, our partner on this trauma resolution, Senator Johnson, was really pushed to be active on this issue by the First Lady of Wisconsin. This is one of her platform issues. She's an incredible champion for childhood trauma and making sure the state of Wisconsin is trauma-informed. And now we have a new champion in the Senate with Senator Johnson joining us on this resolution and gets it now. Other members that are influential, police chiefs, superintendents, a lot of times those folks get it and they see it every day, and they would be really important to leverage their influence. And then, as Jeff had said, have stories about trauma-informed care and how it's made a difference, and really in the lives of not only families but children, and making teachers' jobs easier, law enforcement seeing differences, judges, health practitioners, and then data is always very important. It's sometimes a challenge when the programs are newer, but any numbers you have in terms of graduation rate improvement, family reunification, and then being conscious of time. Our time is very limited, members' times even more so, and so making sure that you're getting to the point, and you are also making sure that meetings aren't running long, and that you get right to where you want to be in terms of my next point, which is have an ask. You spent all this time securing a meeting with a staffer, gone back and forth on their schedule, got that 15, 20, 30 minutes. You've gotten them interested. Don't leave without giving them something to commit to, or something to at least be able that you can follow up on. I can't tell you how many times I've had meetings, I care, we get to the end of 30 minutes, and it's like, well, I'm glad that you now understand this. And I think sometimes with the issue of childhood trauma, we really are still trying to educate people. But even if you have to make up an ask, if it isn't to co-sponsor legislation or a resolution, come visit, again, like as Jeff said, come visit our center, come visit when you're members in the district, some ask, and then always follow up. My inbox is a quagmire, as many staffers are. And my responsiveness isn't where I would love it to be, but just always follow up with people, because popping it back to the inbox is important. What not to do, I could list lots of things, but I'll just leave it at a couple, which is don't bury the lead. Don't kick things off without first just making sure people understand before you start talking about programming and talking about all the good work you're doing, to understand what trauma is and what childhood trauma is and what this means. Second thing is don't be unprepared, which I think I just walked through a lot of ways to be prepared, but just don't come unprepared and not know about the state you're meeting with. Even if you're not from that state, but you're, just taking that meeting, make sure that you've looked into, this isn't South Dakota, it's North Dakota. I can't tell you how many times I have that meeting sometimes. And then, as Jeff mentioned, there's a lot of opportunities for influence as an advocate, so don't underestimate the value that you bring to the table. Your insight and on-the-ground experience is really important and super valuable for those of us who, are at a desk trying to do the best we can in policy making, but unfortunately don't get to spend every day with your eyes and ears. And then again, as Jeff had mentioned, it takes a long time for policy change, so I would just say don't get frustrated or discouraged at the glacial pace of federal legislation or setbacks, and don't take that as some sort of indicator about the commitment to the issue, because I think that they may be baby steps, but it is progress. And so with that, I'll send it back to Jeff.
Great, thanks so much, Megan. And if you've got a couple minutes to stick around, maybe we'll have time for a couple questions. And if folks have questions for Megan, we're going to try to do them now because she has to run. So if you've got questions, feel free to type them in. But Megan, I was hopeful that you could talk about kind of the interaction of local and district offices with the DC offices. A lot of the folks on this call are obviously based in states around the country and may not have the resources to get to DC very often. So is there advice you would provide around engaging with district offices, and is that an effective thing to do? And if so, any advice on how to do that?
Absolutely. I mean, that's the reason why members have district offices is because of travel constraints. I know that more than anything, being very far from our state. So I would say asking for a meeting with, your local representatives of your congressional offices is always good. Making sure that they're aware, or inviting them, I should say, to come visit. Asking the senator or the congressperson when they're next in town to come visit, or let them know upcoming events on your calendar. One thing that folks do in North Dakota, which is always nice, is when they do ask for a meeting in our district offices, they ask if either I can join by video conference or by phone, which is just a nice way to make sure that you're connecting with not only the people in the state that do sort of the casework and really have in touch with the community, but that then the sort of policy experts out here in DC are part of that same conversation, and it's a good use of time rather than having the same conversation twice or playing telephone.
Great, thanks. And I think we've got, so I think, Megan, not seeing any other questions. Thank you so much for your time, and thanks for bringing some good news to us today, and happy belated Trauma-Informed Awareness Day. It's always nice of the Senate to wait until the last minute, right, to do something, but I'm really excited that that's moved forward, and we're equally excited about the work on the opioid bill, and so we'll continue to push as hard as we can on that. And actually, it looks like we've gotten another question, if you've got a minute here.
Yeah, no, absolutely.
Someone is just asking if you could talk about what the value is of resolutions and kind of what that means in the larger scheme of things.
Sure. I mean, I think it depends on who you ask. If you ask me, I think it's a wonderful tool for awareness, a way for advocates to, like I kind of said before, come in with an actual ask, but then also on social media and with local press to really draw attention to issues. So, I mean, there's multiple health observance months every month. I mean, it's also Mental Health Awareness Month, so there's been a lot of activity around that. But it's really a good opportunity to focus on a specific issue and draw attention to that and have a tool to point to. In terms of actual legislative teeth, I mean, nothing is changing, the world isn't moving, but we are recognizing May as National Trauma Awareness Month. And I think it's also, I should just add, it's also a signal from the Senate that they recognize it and they get it. I mean, the House also passed their resolution last year, so a little bit ahead of us. And but just to make sure, that this is on the radar.
Right, and the other thing I would add for folks out there is this is a way for members to kind of take the leap on an issue, but not all the way into the deep end of the pool, right? So for folks who may not be inclined to, for political or other reasons, maybe fiscal reasons, to co-sponsor a large piece of legislation like, say, the Trauma-Informed Care for Children and Families Act, you can get them to start speaking the language, so to speak, by getting on a resolution. And so we see a number of Republican offices that are on the Trauma-Informed resolution, and that's really a great first step into kind of bringing them into the fold. So thanks for that question. And it looks like we've got one more. And so this is a question about getting co-sponsors for pieces of legislation. And this probably also gets into some process questions, but the question is how many co-sponsors are recommended before a vote? But I wonder if maybe we could turn that and you could just talk about the process of the Trauma-Informed Care for Children and Families Act and how some of those provisions ended up in another bill, because I think that's really illustrative of how these things work.
Sure. Well, I mean, the larger bill, S774, is, I've referred to it as, and I probably shouldn't, but as a wish list of, really if we're going to start in every angle addressing childhood trauma, what would we want to be doing? And so it's, everything from school-based to every block grant being trauma-informed, all of the federal funds coming out, to law enforcement, to some pilots in the Medicaid program. So really broad-reaching. And we have, we've got good traction, but it is just Democrats on that bill. So in looking at our strategy of trying to advance addressing trauma, obviously opioids are moving, and obviously those of us who understand childhood trauma know that this comes from both angles. It is a traumatic experience to be exposed to addiction, and it is an indicator for later addiction by having high ACE scores. So we really started early having that conversation with the Health Committee, and we had partners, Republican partners, who just, as Jeff had mentioned, not able to jump full in on a big bill that has new spending authorizations. But what can we be doing to advance this issue? So we partnered with Senators Murkowski and Capito and sat down with both minority and majority staff on the Health Committee to make our case of how this was relevant to what they were trying to do in the next steps of the opioid crisis, but also recognizing this has implications beyond opioids to other substance abuse addiction issues. So with that, we were able to carve out parts of our bill. And so there are roughly 6 provisions that, if aren't directly listed from S774, certainly aim or are tracked towards our aims of that bill. And they fit in with where the Health Committee was sort of going with their opioid package. And so I think that's a good example of, you're not going to maybe get the whole thing you want to get passed and you have, everyone co-sponsoring. But we're making progress, and the work that advocates are doing to not only educate members but make this issue part and on their radar back in their districts has been extremely helpful as we try to, again, I don't think it's baby steps. I think these are huge steps. But, again, it's not passing whole hog the legislation we introduced, but being more strategic about how we can put parts of it forward.
Great. Well, Megan, thanks again so much for your time and for all the work that you and the Senator are doing. We're incredibly appreciative of the work you're doing to move this forward, and we look forward for those of us here and everyone on the call to continue helping you do that work. So thanks so much for sharing your knowledge and wisdom with us today, and we'll let you go.
Absolutely. Thank you so much, everybody.
Thanks. Great. So moving from the national to the local level, we're really lucky to have Olga Acosta Price with us today. Olga is an associate professor here at GW, and she also directs the Center for Health and Healthcare in Schools. She is a passionate and effective advocate for school-based mental health services. And she's really been at the forefront of much of the work being done in this area here in the District of Columbia. So we've asked her to provide some context on working on policy at the local level. So Olga, we're glad to have you.
Thank you. It's great to be a part of the team. So I think thank you. Advance to the next slide. So many of the questions and the ways that one might approach trying to be an effective advocate I think are pretty similar, whether you're thinking about tracking things at a national level, at a state level, or at kind of a local city-county level. The kinds of questions that you want to think about in terms of, what your level of understanding and knowledge is around the policymaking and budget setting processes. How do those things happen? Who actually is influential? Whose decision is it to have some of these things occur, again, are the kinds of questions that one would ask regardless of what level of government we're talking about. But in this case, sort of taking it down, although D.C. does function as a city and a state, I'm going to talk about some of the lessons learned as it relates to D.C. really as a city and a locality that has a big interest in trying to support the behavioral health needs of all of its kids and residents. And so there are some differences when if one were to think about how to be effective in the policy arena. One is that it's often easier to get a seat at a table. It's often easier to find and to make the time and find the time to meet with policymakers at your local level. It's often a less crowded environment as opposed to at a congressional level where you may have folks coming from all around the country or from that state, or lobbyists for different issues coming to meet with that representative, or at the state level where you may have people from all over the state trying to really get the attention of that policymaker. Luckily, just by sheer numbers, it's often easier to find the time, and part of it is by the nature of the fact that given that one is part of a smaller jurisdiction, although many of these are large, that you have greater opportunities to interact with these officials. And as we find with many of the places we've worked with, you've had previous encounters or previous relationships or prior knowledge about each other. And so those are things to absolutely take advantage of and leverage when trying to really advance your agenda. Next slide, please. So I just want to start with a couple of general tips that we learned, both as being our center being a technical assistance provider for a lot of different communities around the country, but certainly also from our own advocacy in DC. So just again, in no particular order, but just thinking about some of the things we have seen and heard and know to be effective in our experience. One is that it is important to think about what, as was said by Jeff and Megan, be clear on your mission and what it is you're ultimately trying to achieve. And then really think about what other kinds of policy issues, emerging agendas or are really bubbling up or have already gotten political visibility or public visibility that could support or even hinder your agenda. It's important to pay attention to what is happening in the news, and to know what those policymakers are vocally supporting or not. So it's back to kind of doing one's homework around what do we know about their position, and where we don't know, making a note of that so that may be part of when one meets with the policymakers trying to determine where they might stand on these positions. The building relationships with key decision makers is obviously, again, we've said it a number of times, but it's worth repeating, but really not underestimating the influence of staffers and those who help staff these offices, not only by sharing about what you do and about the data and the stories that make this issue important to you and why you're passionate, but other ways that you can link these decision makers to other constituencies, ways that you can be helpful to them in sort of even advancing the things that they've run on or that they feel are critical to why they're in office. And so, so that you can be seen as an asset to them also. It increases the likelihood that they'll also call on you for a number of things. We've already talked about inviting, legislators or branch officials and others to showcase your own initiatives, your programs, events, what you're doing, and those are certainly good asks to always have in your pocket. Not being afraid, and this is something that even I, as trained as a practitioner and then really moving into being more comfortable in the policy agenda, is not being afraid to be a part of public forums or hearings and providing oral or written testimony is really something that really, once you start to do it, it really does become easier to do. And especially if you do it as part of a network or as part of a team You really can lean on each other's expertise and abilities to take turns in who's going to be the front-facing person for your issue, but it is often a very effective way to get on the record around the kinds of issues that are creating difficulties in your environment. Related to that, and certainly testifying, but there are other ways, and meeting is a way to get acknowledged as a trusted subject matter expert. Again, policymakers, district leaders, they certainly have very impressive resumes and have their own level of expertise, but they are not experts in all of the subjects and the content that that make up the kind of complex social environment that we're all living in, and the kinds of issues that we're talking about that are quite complex and sometimes feeling intractable, and they don't have that subject matter expertise or have the time to make sure that they understand what the latest evidence is saying, or what the best practices are. So again, this is where we can be assets and we can be real helpful constituents to increasing their knowledge, and becoming involved and being willing to be involved in convening task forces, committees, or commissions that are often really help shape some of these decisions. And I will say, as we go to the next slide, that again, it's worth saying that another tip that was said is it does really take time, whether at a local, state, national level. These are things that one has to have a long-term view, sort of short-term asks, but really have a long-term commitment and stay the course. So I want to briefly tell you about our DC example of how we've engaged with local decision makers in a way that has really kept us at the table to really shape some very important public investments going on. As many know, DC, as part of its history, has grappled with not only youth violence and trying to get that under control, but also we have continually prioritized children's behavioral health as a common concern and issue that we collectively really want to make sure we are investing in. A piece of legislation that was passed in 2012, the South Capitol Street Memorial Amendment Act, was something that really mandated and required the development of a citywide comprehensive plan to, among other things, expand school-based behavioral health programs that would really support all DC public and public charter school students and their families. So it was quite a comprehensive and kind of overarching goal that these interventions be accessible, that they would address the current need, that they would really promote social and emotional development and competency in all students. So as a part of that, the district agency in charge of trying to bring much of that forward, which is the Department of Behavioral Health, did create an initial plan that was developed. Public testimony, which was part of the process, is to hear from the public about what we thought about the plan, overwhelmingly had critiques and criticized the plan and identified a number of gaps and problems, and I was one of those who decided to publicly testify, having, again, some expertise in the development and implementation of school mental health programs. In response, City Council, our sort of local legislative body, established a task force and asked that task force to, in a relatively short period of time, over about 6 months, to produce a report that really had us analyze that existing plan, talk about what it was missing, and make some really firm recommendations for how we would address the gaps and areas of improvement. Next slide, please. What we were able to accomplish as a part of the task force, and I should say that I was honored to actually have been asked to then co-chair the task force. This is where, again, sometimes you don't know where things will take turns, where you will be asked to commit quite a bit of time, but it was such an incredible opportunity that, I decided I really was one that I could not pass up to help shape and influence some of the decision-making around this. What we were able to secure in terms of the commitment of our public officials is we secured an additional $3 million in public funding for the first year of implementation starting in this next school year, coming up school year 18-19. We obtained a soft commitment that we would, 3-year commitment, that we would implement this plan over the next 3 to possibly 5 years. Although there could not be a specific financial commitment made, given the way, again, our budgets work, we did secure money for this coming year, knowing that we were going to strongly advocate as a continuous process to identify additional dollars to keep this going. We helped advance, again, a very specific framework. We were very clear that we were not only looking to address the urgent and sort of emergent behavioral health needs, but that also we were going to focus on prevention, early identification, and on helping to build mental health promoting behaviors in schools, so that, again, we were shaping the scope and the breadth of this investment. We also helped identify the kind of governing and oversight entity that needed to be put in place during this 3-year period, which then created the coordinating council, of which, again, I am on, and all those who were on the task force were invited to be on, so that we could have an ongoing way to shape this process. So, and it allowed us to identify other folks in our community that we know to be experts, that we think should be drawn on and be a part of the decision-making through a subcommittee structure, where we could then call on our colleagues in other parts of the city to really help influence some of the other implementation pieces. Next slide. So finally, I think, just to wrap up some of the lessons learned from our local experience, and ones that there's certainly others, but the ones I don't want to forget to mention. One is that there is a lot of work that often, once you do get, as we like to say, an invitation to the table, to that convening of where these decisions get made, whether it's a task force, a commission, or some other entity, it does often require one to think about the fact that you need a backbone organization or some staff that could help get things done in between meetings or in between convenings, as a way to make sure that, again, what you bring to bear actually can then be actualized, that you can actually take action on it. And often, again, with coalitions and committees and groups that come together, if one doesn't think about the fact that they need to be staffed in some way, that could be done by one of the core team members, it could be done by the policymaker's office, it could be done by a district, in our case, a district agency, but just to make sure that you aren't neglecting to consider that kind of work that needs to be done, because it could stall, in many ways, the advancement of the work. Who your members are really matter, but one of the things that we tried to make sure that we didn't do, for example, in the composition of the task force, is to worry about the sort of perfection, that we had to have every member and that we were completely inclusive, because, again, that could immobilize the process and could make it sort of unwieldy to really work as a group. But there were certain voices we felt were really critical. Family voice, for example, and making sure that we had representation from families, and providers, in our case, that had to weigh in on the process we were talking about. In our case, policymakers being a part of our actual committee was very important, because our city council members, their staff, regularly came to those meetings, and that helped propel things forward, so that we really had a sense of the kinds of challenges that our city council members were dealing with, so that we weren't inadvertently asking for things that they really weren't going to be able to deliver on. But then what you just remember that, often you can include members as the needs arise, and you don't have to worry about having everyone identified perfectly in the beginning. It's important that we check our preconceived notions. In our case, assuming that we knew all of the schools that were really the ones that had the greatest behavioral health needs, and then trying to identify resources for them, would have been a faulty way to start, because we didn't have data to really back up those preconceived notions. So one of the steps that we really had to fill, and created transparency for the public, so that school leaders didn't think we were cherry-picking the schools we wanted to provide resources to, is to really take that step and actually use the data to support us in understanding where the behavioral health need was the greatest. I like to say make deadlines your friend. We all have deadlines. We can sort of look at them begrudgingly, but in our case, and as I think is true in others, having both internal and external deadlines really does help keep moving everything forward. In our case, timelines as subcommittees or as our own broader council to get things done, to understand that we had to be accountable to each other, as well as the external ones. So in our case, the plan that had to be delivered to City Council by a date in March, or now where we have to have our implementation ready to go by August of this year, really propels us and just has us not waste time at the same time. So it's sort of the flip of something. Sometimes things can take a lot of time, so you have to be patient. But when the opportunities arise, sometimes you have to be very quick and make sure that you are meeting those deadlines. Finally, again, leading back to some of the communication goals, don't forget about communicating to key stakeholders about what you're doing. That's both internally, so when you have a coalition or a group, remembering to let the other members know about what the group is doing and what those policy opportunities are, so that you're not catching some of your own members off guard, but also thinking about your external partners and the ways, the stakeholders that really are critical to advancing your mission. In our case, we made the mistake of really not stopping to communicate to our school leaders what this whole work was building to, and that we wanted to reach out to 212 educators, and we hadn't stopped to think about those communication pieces. And so we're doing that now, and I'm happy to say that we're well on our way to a very robust implementation that really started with, in essence, a testimony around how we could do this in the best ways. And so we're thrilled to be able to have shared some of our lessons. Thank you. Back to you.
Thanks, Olga. Thanks for that. And we've taken a look at kind of a national perspective as well as a local perspective. So now we wanted to move down to the community level, and knowing that many of you on this webinar work directly in community to give you some ideas about really how to empower and elevate community voices as you're carrying out your policy work. So we're really glad that Vontriece McDowell can join us today. Vontriece is part of Alive and Well Communities in Missouri, which is part of our BCR Collaborative. She's the Director of Community-Based Initiatives there. And Alive and Well has really done some exceptional work around bringing community voice to the forefront of their work. And so we've invited Vontriece to share that experience and provide you all with ideas on how you might empower community voices in your own work. So Vontriece, take it away.
Thank you, Jeff. You can go to the next slide. So Alive and Well Communities came about from 3 different initiatives that was taking place in our state here in Missouri. So that's Trauma Matters KC, Resilient KC in Kansas City, and then Alive and Well FTL. And as our funding began to end with those initiatives, the demands and interest for this work was still increasing. And so we all merged to develop Alive and Well Communities. Next slide, please. Our mission at Alive and Well Communities is to activate communities to heal. And what we do is we work with organizations, institutions, individuals, and communities to help them understand the impact of trauma and toxic stress. But ultimately, we're doing this because we want them to take this science and this understanding and influence and change policies and practices. Next slide. So we do not do this work alone. We are a small but mighty team of 7, but working across the state to build trauma awareness and change policies. We are blessed to have ambassadors, and we have 300 plus folks that represent multiple sectors, professional sectors, and interests. And what they are doing is working towards building a trauma-informed community. Next slide. Next slide. Okay, thank you. And so we know with all those interests, folks can come to the table and just want to start any and everywhere, or they may not know where they can start and where they can use their expertise. And so we've developed this framework to help them understand how they can begin to engage in their community around this trauma awareness piece. And so we want folks to understand that you don't have to jump in immediately and start advocating for policy change and start trying to lobby if you don't feel comfortable in that space. You can start by just deepening your knowledge, the knowledge of your neighbors, the knowledge of your friends around the impact of trauma. And then that can grow into connections. And then obviously we would love everyone to grow into that activation space where we're truly driving change. Next slide, please. And so when Alive and Well started almost 5 years ago, we had all these ambassadors from these different interests and different sectors. And as we evolved into our own organization, Alive and Well Communities, just recently in December, we did not want to leave those voices behind. And so what we did is we built out our organizational structure to ensure that our ambassadors are always at the center and always at the core. And so our ambassadors now make up what we call our community council, and we're constantly going back to them for input on the work. And then from that, the Community Council has elected 27 steering committees in the St. Louis area, and they're going through their nomination process right now in the Kansas City area. And the steering committee is really that governing body and that voice where we're taking our ideas and we're asking them, you're connected to so many different sectors, you're connected to so many different people, are we getting this right? What do we need to be doing differently? Next slide. And so here are just some highlights of some of the ways the ambassadors have been able to build, connect, and activate. I won't read all of these to you. I will say that it ranges from folks trying to change policies at their work, doing things like creating mindfulness spaces, quiet corners, getting televisions out of their waiting rooms at healthcare clinics because they realize that playing CNN might not be very trauma-informed as folks are waiting to see the doctor. So small changes like that. Next slide. Other areas, we have students as well in some of our local universities. One highlight would be St. Louis University here in their med school. Their students came to one of our trainings and they really took that knowledge and began to activate change on their campus. And what they're doing now is embedding the trauma awareness training in all of their orientations for rising med students and future doctors. And that's something that they've decided to do on their own. That's not what we told them to do, but they've taken this knowledge and this understanding and activated change on their campus. Next slide, please. Next slide. And so, previous slide, please. Thank you. So one thing that we noticed as we went back and assessed the demographics of our ambassadors from when we first started as Alive and Well STL is that we noticed that a lot of folks that gravitated to this information were folks that were kind of already in the field, clinicians and social workers and teachers, but we did not have a strong voice from what I like to call the neighborhood folk, the folk that specifically represent those communities that are dealing with those adverse community experiences that we talk about when we think about that tree. And so we were very intentional about seeking out ways to diversify our ambassadors, and one way we were able to do that is to hire folks and pay folks. And we call that group of very special ambassadors our community consultants. And what they have been doing is working in their neighborhoods to spread the information or the understanding of trauma and the impact of toxic stress and how that can show up with the goal of changing the perspective that the neighbors might have of one another. Can you go to the next slide? And so here, and I won't read all of this, but we've wrapped up our initial evaluation report, and you can see some of the impact that that work has had from that special group of ambassadors out there working with their neighbors. I specifically chose this picture from our workshops because the consultant that did these workshops also spoke to something that we didn't really get from the evaluation because we didn't ask, but social connectedness. And research tells us that communities that are dealing with chronic community trauma, there tends to be a breakdown in those social networks. Folks are going through and they might feel like they don't have time or the energy to be connecting or helping others. Well, this consultant shared how when folks then show up to workshop 3 or workshop 4, neighbors start to wonder what's going on. Where is my neighbor and why aren't they here? And so really beginning to build that connection with one another. And so that was very powerful to hear. Next slide, please. So what are we going to do with this, especially as we're thinking about how to build out our policy agenda? And so one of the things that we've been very adamant about and very transparent about is that we don't quite have a policy agenda yet. And so that's why we're so excited about partnering with BCR to build that out. So we've heard a lot from our community consultants and from our ambassadors. We can't continue to ask the community for information and not use it. And when I say we, I mean all organizations that are working at the community level. And so what we want to do is start to be able to build a movement with this information that will ultimately activate community members to advocate for themselves and for sustainable change. And so we want to use our steering committee to begin to prioritize issues based off what we're hearing from the community. And then through there, we want to build awareness around these issues and activate our ambassadors. What you see under this arrow here are just examples that we've been brainstorming on ways we really want to begin to carry out this action. And then ultimately, we would definitely want more community members saying they want to be part of this movement, they want to be ambassadors, and we want to begin to start holding our elected officials responsible for what may or may not be happening specifically at the neighborhood level. But with our steering committee and our ambassadors, we recognize that we have so many resources around the table and so many connections to other organizations that we can use to really begin to activate that change. And that is all. Thank you, Jeff.
Thanks so much, Vontriece. I always love hearing about the work you all are doing, and I think it's a great example for everyone about the power of really being embedded in community, and when you all go to speak with those policy makers, to know that you've got the community behind you and with you is really important and really powerful. So you heard us say earlier that one of our mottos here is no stories without data, no data without stories. So you've heard a little bit of the stories piece, so now we want to get to the data piece. So we've got Caitlin Murphy, who is the project manager here at BCR and is our in-house data guru with us. And so Caitlin is going to talk about how to effectively use data and where you can find it and kind of the context to put it in to be effective when you're in front of policymakers. So Caitlin.
Great, thanks, Jeff. Before we open up to questions, we wanted to dig a little bit more into the guiding mantra that we have here at BCR that Jeff just mentioned, and we apply to all of our work and especially our policy work. No data without stories and no stories without data. And Vontriece just did a wonderful job describing how Alive and Well Communities keeps their communities and their stories at the center of their work. And she and the rest of the team also did a fantastic job last month bringing those stories down to the Hill. But Vontriece's team not only did a great job bringing their stories, they also paired it with data. And pairing the stories and those data together creates a solid, strong hook before they made their policy asks. And so something we've heard from our BCR teams is that they feel pretty good telling their stories, but it can be difficult to find the data to support their stories, to paint a full picture of the context that their children and their families live in. And we understand that. Data sources can differ county to county, state to state, and it can be hard to know what data exists in your own city, county, or state. And here at GW, the BCR national team works with the local BCR teams to help them identify these sources at their local level. And I'll highlight just a few today, which our teams have found particularly helpful and which are also highlighted in our guide. First, you'll see on the slide here that one source for a wide variety of state-level child, family, neighborhood, and school data is the Data Resource Center for Child and Adolescent Health, located at childhealthdata.org. The DRC is handy in that it has a user-friendly data query which allows you to break your data down by race, ethnicity, age, income, and over 25 other demographic topics, including most recently and very interestingly, ACE exposure. This means that right on the website, you can look at data points such as missed school days and see how that differs by the number of ACEs that a child has experienced. Could you advance, Daniel, please? Right, so you'll see that what came up on the screen is that on the DRC, right on the website, you can see that while 6% of children without ACEs miss 1 week of school a year, almost 20% of children with 2 or more ACEs miss a week or more of school a year. Another handy resource is the Annie E. Casey Foundation's Kids Count Data Center, which in addition to providing state-level data, also has select county and city-level data regarding child and family well-being, some of which can be subgrouped by race, ethnicity, age, or gender. Next slide, please. County Health Rankings is another resource that's quite popular and you may be familiar with and is funded by the Robert Wood Johnson Foundation. This site allows you to access a wide variety of county and state-level data that are all relevant to the pair of ACEs that Wendy was describing earlier, such as community violence, drug overdoses, access to healthy foods, children in the juvenile justice system, children in foster care, et cetera. And last, Community Commons is another very handy website which pulls county-level data from a long list of publicly available data sources and displays these data right onto county maps. So if you're a visual learner or you're working with visual learners, this is a really excellent website to use. It includes data such as the percentage of unsafe housing in your community, unaffordable housing, grocery store access, and much, much more. I really encourage you to explore all of these resources that I just mentioned. Next slide, please. Another place teams can feel uncomfortable is talking about the data itself in a way that feels natural and not too academic. So we've provided just a few tips here and within the policy guide as well for you to consider. First, when communicating the scope of the issue you're presenting, we recommend using a reference point commonly known within your community. For example, the number of children in your city who's experienced 2 or more traumatic experiences that may fill up a popular stadium 2 or 3 times. Second, it's important to communicate the inequity of the issue, how it might disproportionately affect individuals of different races and ethnicities, income levels, children of special health care needs, and several of the data sources I just showed you allow you to break the data down right on the website. Next slide, please. Third, when selecting your data points, we recommend thinking about your audience. What topics would persuade them and what data potentially exists on these topics? For example, if you're speaking to an educator, you may be interested in exploring what kind of education indicators exist right within your region, such as missed school days, school readiness, and et cetera. And as we mentioned earlier, we know that this data can differ greatly city to city, county to county, state to state. So starting to do some exploration can be very helpful here. And fourth, because we can't say it enough, in the midst of all this data, it's critical to remember to always pair data with local stories. To keep in mind that decisions are almost always made on an emotional level, and then data is used to rationalize those decisions. And last, you could consider using a simple visual to illustrate your data if it doesn't seem too distracting. Next slide, please. On this last point, you can see here an infographic which we pulled together for the BCR Oregon team for their most recent trip down to Capitol Hill last month. We created this infographic as a communications tool to help introduce new partners and legislators to the concept of the pair of ACEs. Similar to what Wendy showed earlier, you'll see the soil below the tree represents community environments and how adversities such as violence, unaffordable and unsafe homes, lack of access to healthy foods show up in different communities throughout Oregon. The data points here were pulled from a variety of sources such as community commons, county health rankings, et cetera. And the tree above the soil shows what can grow from poor soil. ACEs such as parental substance abuse, parental mental illness, economic hardship, domestic violence, et cetera. And all of the ACE estimates that you see here were pulled from the 2016 National Survey of Children's Health, which is based on childhealthdata.org. And when the BCR Oregon team shared this infographic with the representatives down on their hill, Their representatives may have been aware that in Multnomah County, which is their capital city county, a quarter of their families can't afford their housing costs or live in unsafe housing. They may have already known that the crime rate is double elsewhere in Oregon, and that the stress that these adversities have on parents and in turn their children can be massive. But BCR visuals like this attempt to bring everything all together, showing us visually how ACEs can grow from the poor soil of adverse community environments. And what you'll see on the right is because we're strengths-based, the back of the infographic shows where we're hoping to head. The goal is connected systems and supports, enriched soil for supportive adults and healthy households. And you'll see next to the tree that we know that this can yield fewer justice-involved youth, fewer youth in mental health crises, families starting to draw on their strengths, et cetera. And this entire infographic is trying to make it clear that the solutions are really multi-sectoral. So after providing their community stories, pairing it with community data to support these stories, and providing an overall framing of the solutions, you'll see on the very bottom of this infographic that the Oregon team made their ask to their representatives. 3 specific policy asks regarding Medicaid, the Trauma-Informed Care Act, and the Families First Prevention Services Act. When you're making your policy ask, we encourage you to think about whether an infographic like this would be helpful to make your ask. It can be quite handy for offices to reference your data points and have them on hand for later, as well as your policy ask very clearly laid out. These slides will all be available after this webinar if you'd like to reference a graphic such as this for inspiration for your own infographics. And with that, I'm going to turn it back over to you, Jeff.
Great, thanks, Caitlin. So we've got time for some questions, so feel free to type those into the chat box and send them to everyone, and we'll be able to see them as they pop up. So I'm just going to read the ones that have come in so far, and we'll answer them in turn. So the first question is, what are the measures you use for communities' resilience? Other than getting policies in place, how can we evaluate the effectiveness of our efforts in our local community? So fortunately, this is something that we spend a lot of time thinking about, so I'm going to ask Wendy to talk about how we approach it here.
Funny that we should get that question today, huh? So I'm glad that someone did pose that question because, again, earlier, if you have an opportunity to go to our website and pull down that para-basis tree, I think that gives you not only a guidance as to thinking about who should be at the table, but also how you would measure success that begins to help us think about community resilience. And so our framing of community resilience actually is very much informed from the disaster preparedness and emergency response literature that looked at components of resilience that predicted a community's ability to be able to bounce back after a major shock. So think hurricane, terrorism, or some sort of other disaster. And so that was looking at how well communication flows, the level of social competency, social capital. But one of the other key pieces is looking at economic development. So with that is also bundled in access to education and health care, all of those supports that we know from our literature with regard to psychology and psychiatry, with regard to those buffers that need to be in place to support individual resilience. So again, BCR is focused very much on the community and systems aspect so that we can get down to those types of buffers that can support individuals. So when we would think about measuring long-term resilience of a community, what is the level of affordable housing? What is the level of employment, the access to economic mobility, public infrastructure that actually supports individuals' ability to support health and well-being? So it's not just thinking about individual outcomes such as obesity or heart disease or mental illness, although those things are certainly important. We want to make sure from a community resilience perspective that we are able to measure those supports that would actually support the individual outcomes. I hope that helps. And certainly we can be available to answer any other questions and provide guidance offline.
Right, and a couple folks have asked for links, and we'll do our best to include everything that's relevant when we send out the slides, but also our website is pretty accessible, and you can find some information about each of the individual sites there through higher level snapshots, and that might also give you some inspiration on how to frame some of these questions in your own communities. So a couple other questions coming in. So what challenges and ideas for overcoming the barriers have you experienced in working with or attempting to work with school districts? So Olga, I might let you take the first stab at that. So we're thinking about ideas for overcoming barriers in working with or attempting to work with school districts, and I presume to implement trauma-informed policies. Yeah.
Great. So I think that, so one is that we often need to understand how those districts are organized, and so an approach for how we might be most effective means that we have to understand who's responsible, how they organize kind of the leadership around student wellness, student health issues, truancy, attendance issues. Where are those housed? Who are the leaders or directors responsible for those, as well as what are some of the kind of education policies that are already driving some of those actions. So again, there's often a need to do a little bit of background work because if we, which often, again, in public schools, a lot of these will be available on public websites, they'll be publicly accessible, so that when you do ask for meetings, you're asking to meet with the right people, or at least you're getting close to the right offices, and that when they see that you've done some of that background work, I think it really communicates the kind of the seriousness, the commitment that you have, and your willingness to do some of that. That I think often goes a long way. We also want to be careful, for example, that we understand, who the real decision maker is. So in DC, for example, we have DC public schools and we have public charter schools. And so if one doesn't understand that difference, we might be asking for engagement with public school leadership, public charter school leadership, for example, where DC public schools has no authority. And so at that case, if you wanted to really think about the entirety of our public school system, you'd go to an agency like our Office of the State Superintendent of Education. So again, it's always sort of understanding the structures so that we can more effectively make those asks to meet or for data, or to understand where priorities are set and where future agendas might be, and where funding and money is being allocated. So that's my initial response without having more time to think that through.
Great, thanks. And I see someone else commented that as a school nurse, they often feel kind of isolated in this work. So Olga, I wonder if you'd want to talk about kind of different ways to find allies, and I could imagine myself as the lone school nurse at a school, and so how to find partners that are maybe at other schools, and whether that's through professional associations or some thoughts you might have.
Yeah, there. Absolutely. I think certainly what you've queued up, Jeff, makes a lot of sense. If you are a sort of a school-based provider, it can often feel very isolating. You're often probably faced and challenged day to day with the realities of the challenges of stress and trauma, and may not have even the opportunity in that setting to consult with others. Certainly, again, depending on who you're hired by. If you're hired by the school district as a nurse, then, we certainly encourage thinking about the management level at the district level in terms of how much of this may be going on at the district level, and letting them know that you want to participate at a broader policy or systemic conversation around how to connect to others. If you're hired, for example, by a Department of Public Health, which sometimes nurses are, or a hospital system, which sometimes school nurses are, then certainly, again, thinking back to that organization, what management or leadership is there, and express your interest in being a part of sort of broader conversations. Certainly, professional associations, either ones that are national or that may have state or local chapters, is to really kind of think about doing that. But there are also others that maybe not sort of specialized just to your profession, but think about other child health, coalitions or organizations, that they're going to be called different things in your community, but they may be run by a local sort of pediatric association or a hospital association. So sort of broadly look for those, but I think those are some starting points of where you might connect with others so you don't feel so isolated.
Great, thanks for that. So we had a few other questions and comments come in. So a lot of people are asking for the Oregon example we provided, so we'll make sure that we send that out to folks as an example. And then I see someone shared 2 policy papers from Futures Without Violence, which I can attest were both really great papers and resources, and would urge you to check those out. We also had a question about, as we're thinking about data, what are the 5 data points that are sort of most relevant or engaging to collect in your community? And I guess I'll start out that answer just by saying that from the policy standpoint, it really depends on your audience. So as you heard over and over again, really needing to understand the values and the motivations of the folks you're trying to influence, and then painting the picture that way. So, and you can also look at maybe the committee that person sits on, or where they have the most area of control. So, you know, again, if they're interested in education, looking at those education outcomes, making the link to ACEs and trauma. If they're interested in the opioid crisis, making that connection between both the impact of the crisis on kids and then also the kind of intergenerational piece of this, which, you know, folks who are addicted are often themselves have a history of trauma and ACEs. So I think you really need to tailor it, but I'll open it up to Wendy and Caitlin for their thoughts.
Sure, Jeff, thank you. And I mean, I think that what you speak to are certainly those data points that would resonate at the policy level. But I think also if you're thinking about from getting a larger stakeholder buy-in, whether you're in your coalition building phase or advocacy phase at the local and state level, is to really tailor those data points that are very specific to that system or sector in which you're targeting. So as Jeff spoke to education outcomes, you know, if you are looking at engaging your local school district, you know, one of the things that we provide to our teams is guidance and thinking about what are those measures, those performance measures in particular, that a lot of these systems are already going to be measured on, not creating a new metric, but actually thinking about the things that would drive an individual or an organization to be a part of the work, to see that it's not just about what they're contributing to the community, but also how this work could then contribute to their own outcomes. And so when you think about a local school district looking at their graduation rates, their retention rates, how does a trauma-informed approach improve student performance or improve engagement, even retention of teachers themselves? When you're thinking about from a public health perspective, what would be the prevalence of behavioral health issues for children, if that is a main driver? From a public safety perspective, is there a local effort that is already in place with regard to a drive in juvenile justice reform and juvenile justice or justice-involved youth reduction? So that would certainly be an important metric when you're thinking about overall community resilience. And one of the things, too, that you can begin to think about is how all of these metrics that I just discussed are actually interrelated. So if a school system wants to improve their graduation rates, well, they need to make sure that actually the kids are in the seats, so that they're actually matriculating through the program. And so one of the things that we would want to see, obviously, is a level of reduction of juvenile involvement. So there are some mutually reinforcing metrics there across multiple systems, and we found that by helping to highlight that and find the way that those systems can work together is actually quite a successful way of building buy-in across what may seem very disparate systems.
Great, thanks. So we've had a couple questions asking whether BCR works internationally, and I'm looking here at the 2 other faces who are really the colleagues of the BCR team and wondering how we would manage to get all of these places with our small team. But the answer is no, we don't work internationally yet.
But we do have passports and we do all travel. We all have our shots. But actually, there has been some discussions that are ongoing right now with that potential. So certainly if you have some interest, all of our information, our contact information is publicly available, and I welcome your conversation.
And probably the other thing to check out there is the 100 Resilient Cities
Yes.
From the Rockefeller Foundation, which a number of those cities are international, so that might be.
Yeah, and we do have a relationship with, if you want to just quickly Google 100 RC, if you are from one of the 100 RC cities, we are certainly working with the Rockefeller Foundation on two of their sites right now. But there is an opportunity perhaps to connect some of your resilience strategy planning to our work as well.
So we've come to the end of our time. I think we have a few questions we weren't able to get to, but you can see up on the screen, this is all of our contact information, as well as the websites for the organizations we spoke about today. So feel free to reach out to any of us if you'd like to follow up, and we'll respond as quickly as we can. Thank you all for joining us today. Hopefully these are tools and resources that are going to be useful and valuable to you. And I'm going to turn to Wendy for just a closing comment before we sign off.
So I definitely want to thank our funders, the Doris Duke Charitable Foundation, as well as the Kresge Foundation, for all of their support in this work, but more importantly, for all of those who have tuned in today and that do this work every day for our children and our families and communities. I want to thank you for hanging in, tuning in, and showing up every day in our communities. So go out and build a resilient nation. Thank you.
Thanks.